Folks, welcome back to the next episode of the Dental Implant Podcast. Now, you're probably thinking, Pav, what's going on here? Normally there's about 2 months in between episodes, and now all of a sudden we're getting loads. Well, I'm trying is what I can say to you. So I'm very happy to have with me Rob Felker today. Rob's a friend of mine. We are both key opinion leaders for Meisinger and J&S Davis. The reason why I've asked Rob to come over today is to speak about the Yxoss customized titanium membranes. Rob's going to do a little bit of an introduction to himself as well, and then we'll just pick up a little bit of a conversation. So Rob, introduce yourself please, if you wouldn't mind.
Hi, Pav. Thanks for having me on one of your podcasts this evening. Yes, my name is Rob Felker, and I've been using Yxoss since 2018. So I'm using it in my general practice where we've been open since 2013. And this is my alternative to block grafting. So where we have, deficient ridges, my first choice now is Yxoss and granular grafts.
Thanks, Rob. So just so that everybody who's listening is aware, Rob has just finished a recording for my academy, and Rob runs his own academy as well, the Augmentation Academy as well. So we've just been recording for an hour and a half. We thought, you know what, we'll do a quick 30 minutes now as well for the podcast as well. So our brains are on fire, although this next half an hour is going to be a bit repetitive. So
right, we're ready to go.
Rob, I think probably a good place to start was where we were wrapping up just a few minutes ago, talking about the key cornerstones of grafting. Okay, now you and I know we have had patients where we've had patients. We have both done courses where you go, these lecturers are doing beautiful cases, and you go, oh, it's the technique. If I employ this technique, I'm going to have amazing results, and that's, you go, you learn, you come back, you do it, and you don't quite get the good results. Okay. So I think before we start to move on to Yxoss, I think one of the things that we should speak about the cornerstones of successful grafting. And I've covered this before. The cornerstones are, where's your blood supply coming from? Okay, the osteogenic potential of your graft material, how you stabilize that graft material, and then passive closure on top afterwards as well. Okay, if you don't get those, doesn't matter what technique you use, it's not going to work. Okay, people know that I like autogenous. And when we're talking about autogenous, we use micro screws, Prof. Curry's plating technique. It's designed to fixate that material that we're using. So, Rob, have I missed anything? Do you agree with that? And then can you segue into the Yxoss and kind of give us a little bit about the background of Yxoss, how and when you use it, and I'll leave it to you.
Yeah, Yxoss is actually a way of stabilizing, and one of those four cornerstones that you're referring to is stability. And a lot of techniques, such as a sausage technique, is quite technically demanding to get stability of a graft using a dozen pins. It puts pressure on you on the day of the surgery as well. You've got lots to think about. Am I going to get that graft stable? Can I put enough tension on that membrane to for it not to move? Then you'll be worrying about micro movements down the line. And if you've got micro movements, you get granulation tissue. So Yxoss is designed to eliminate that thought process. You don't have to worry about getting stability, because the titanium framework has its natural stability anyway, and you'll find that you don't need to be placing multiple screws. You can't use pins with this technique, by the way. You do need to use screws, and the Yxoss screws, even for 3 units of teeth, you only need maybe two screws to stabilize it. And when I talk to my patients after treatment, when I've done a series of pins for them, they all say, oh, that tapping. They said, that tapping's a big understatement, Rob. And he said, that's the worst part. But when I started using Yxoss, which people or dentists would deem to be more invasive, they're like, no, the worst bit was at the end when I was tired and, you having to put the last few stitches in. That I can live with, because it's just a matter of time, a bit of extra local anesthetic, problem solved. But when you're putting through people a series of things that they don't like, and there's another alternative, seem quite appealing. So where did Yxoss develop from? I mean, it's not a new technique using titanium of some kind to support a granular graft. And I mean, Prof. Corey's documented this in his book from 2007, where they're almost using glorified kitchen foil as a method of holding in graft material. He still used pins, and he probably used some of his healing caps to support it, like we have done with our collagen membranes. But the issues that we had is it's time consuming. I mean, trying to adapt that foil to your site at the time, getting rid of all those sharp edges, not cutting any periosteum, not going to be poking through your flap later, or whilst all cutting through any nerves, the mental foramen, you want to be well clear of that. So there's lots of things you're going to be concerned about, and all these risks are adding up bit by bit. So what Marcus Seiler did, who's the inventor of Yxoss, he took the digital development one step further, where he can use your DICOM data to design a framework, and it's designed before your surgery. It's designed with certain criteria. So it's going to be at least 2 millimeters away from any bits of anatomy, be it adjacent teeth, be it mental foramen. So you can confidently place this titanium framework confidently and passively. So all of a sudden, when you're in surgery, you don't have to worry about adapting anything. You don't have to worry about stability of anything. You can worry about other things. Once you place your granular graft, the advantage that I found with Yxoss is you don't need to be harvesting huge chunks of the patient's bone. You can just use local scrapings. I mean, again, one of the cornerstones you're referring to, Pav, is the osteogenicity of the actual site. Now, using a safe scraper on that site increases the cell's osteogenicity. So you're actually increasing it by just taking local harvest scrapings. And you don't have to go to a second site every time. So those anterior cases, you can use a smaller scraper such as a Micros to get your bone, and you can keep the site simple and easy, and easier for patients. They don't have a secondary site they have to worry about healing.
I was just going to say on that topic, I really like safe scrapers. Okay. So from my point of view is I know a lot of people, they will use, and I know that you've shown this as well, they create perforations in the bone. Mm-hmm. The way that I view it is that, yes, that increases blood supply, but you're not activating the entire bony surface. No. Okay. In order to activate the entire bony surface and then trigger the healing cascade, you need to scrape the entire bony surface.
Yes.
So actually, when you're using a safe scraper, you are doing two things. Firstly, you are harvesting autogenous bone. And then secondly, you are activating the entire surface and telling the bone you need to induce the healing cascade. Mm. So it's not just a matter of, oh, we're getting bone here. We need to understand what's going on, that we are triggering the healing cascade on a histological level, so that actually the materials that we put on top afterwards as well, they will want to, everything is starting to heal, okay? Is we think about grafting, we think about, we want to see the blood supply, but that's a macro level, is the bone heals on a microscopic level that we can't see. So just putting these perforations in and not scraping the surface, for me, I don't think that's enough. I think you need to at least scrape it, if not do both.
Yeah, and exactly. And a lot of people, when they start doing this, they don't want to scrape the site because they think they're destroying the bone that's there, but actually you're doing the complete opposite.
Yeah.
So I think advocate that definitely, and I too also perforate. We've got a special burr, decorticating burr that I use. So it's got a dead stop on it at 3 mil, so it's very easy to use, quite efficient, and you can decorticate quite quickly. But do that after you've used a safe scraper, because otherwise you get rid of your holes. Says a man that's done it before. So you quite quickly and quite efficiently can feel the site without having to worry about harvesting elsewhere. So you got your blood supply, you've increased the bone surface, and you've got stability of your 2 screws, and your graft is in place. And the final cornerstone that you speak about is your soft tissue closure. And I don't think this just applies for Yxoss, it applies for any grafting technique. You need to get closure with 2 layers. It needs to be passive, and it starts off with deep horizontal sutures, and then finish off with simple interrupted on top. That way, you've got the passive closure with the interrupted, where the horizontal take on all that tension. And I always find it easier to start with a site that's well healed. So don't do it at an extraction site. I mean, if you take out the tooth, that's 5 mil of tissue gone. That's 5 millimeters of extra tension you're having to apply to your flap. So keep things simple, let it heal, and then once you've got in the correct phenotype of soft tissue and complete closure, then you're ready to do your graft.
And I think when you speak to anybody, like, you know, I've had Balaji on the podcast, you know, I've done his course as well. He says the same as well. He was like, you know, the graft has to be stable. You know, you have to think about where the blood supply is coming from, and everything always finishes off passive flap closure. And I see a lot of people where they're trying to achieve passive flap closure using 3-0 sutures, and their method of passive flap closure is pulling as hard as what they can on the sutures. You know, is what happens is you know, Luca Di Stavola has done some beautiful work where he's demonstrated if your flap tension is 0 to 5 grams in the flap, which is not much at all, then you're not going to have wound dehiscence. You know, if you go 5 to 10 grams, the risk of wound dehiscence goes up to 20%. I think it's 20%. And when you go above 10 grams in the flap, 10 grams is not a lot.
It's not a lot at all.
The risk of dehiscence in the flap jumps to 40%. You know, if we correlate that to large grafts, what do we know? We know in large grafts that the risk of exposure is around 40%. So actually what's happening is it's not the fact that, oh, it's a big graft, therefore it's people are not achieving passive flap closure. And this is really, really, really important. Okay, but I think we're segueing a little bit too far away from what I wanted to talk about. So let's try and get it back to the Yxoss, Rob. So this is your forte, right? But so you're giving us a little bit of background about it. Are there different types? What, you know, what's the workflow for it? Tell us a little bit more, please.
Okay, now, I mean, Yxoss has been around for a while now, and they've actually pushed it further and further. Now there are 3 choices of designs. So you have the Yxoss Classic, which is a very open design, which works really well. It's at the cheaper end of their options, which is quite an efficient way of doing your first few cases, getting used to working with it. But you will find as time goes on, you probably start doing the larger cases that having the bone ingrowth, maybe you get the odd partial exposure and you get soft tissue growing into it. It gets a little bit harder and a little bit more taxing to maybe remove the framework. So what they did, they've developed this this sort of middle step where you have a highly dense titanium towards the edges, which is a denser packed titanium. So it covers more, so there's less gaps in it. With the fewer gaps, you is less likely for bony ingress to go in and soft tissue ingress as well. So when you do try and remove, it's a lot easier to separate and remove. And then you also have the final design, which is the fully protect one, where the titanium is very tightly woven together. Still pores in it for the blood supply to mix and things, but your chances of getting any bony overgrowth is a lot less, and therefore it's a lot easier to separate and remove. So you can hear me now saying bony overgrowth. We're getting too much bone. It's the problem. So again, it's not an issue. You know, it's not a major thing to have where you're doing a graft. You've got too much bone. You can't remove your framework. It's just a little bit fiddly. They're trying to make things a lot easier for you. And ideally, you don't want to leave any of the framework behind, although it is sterilized titanium. It's no different to your implant. So you can leave the odd fragment behind, but we don't advocate that if you can help it. Yeah. So, I mean, those are the three designs. You have to remind me what the other question was.
I don't remember, but I'm happy to be guided. I mean, what's the workflow for this?
Sorry, yeah, you did ask the workflow. I mean, there's a digital side to it. So there is a website from Yxoss that you have to sign up to. And then you can plug in your data, you register with them, and then you can send them your first case. The first case you send them is you just fill in patient's details, and you have to send them DICOM data. And it is DICOM data in its purest form. You have to drag and drop the individual slides, not necessarily a folder. We've had some issues with that in the past. So make sure you highlight all the individual slices and then drag and drop into their website. They will receive it and they'll come back to you with a design. And this design you can modify. The people that are designing these are not amateurs. in Stuttgart, where they're based, it's got Mercedes garages and Porsche garages, and a lot of these people that are helping you design have this mechanical and engineering background, plus 6 months of training from Yxoss as well. So they know what they're designing, and having something designed by them, you can be confident that it's a sensible design. Once you approve the design, it will take a few weeks to be maybe printed and then delivered. The whole process from design to delivery is about 3 to 4 weeks. Sorry.
I was just going to ask, what is your rate of, oh no, this isn't right, can you change this? What's the normal reason for that?
Honestly, I've never changed a single design. I've been happy with every design they've sent me. I know other people have tampered with the design a little bit. Why would I change a design? I would change a design that I think, oh, it's too close to something, a root, or maybe I haven't got enough bone to then put a screw into to secure it, so I'd want to extend it. Or maybe the site I want to put a screw in is actually above the sinus with a 1mm cortical plate, and we probably want to move that. So they were probably the reasons why I would change a design, but I've never had to change a design that I've been sent. So I'm happy with everything I get, and I've just accepted every single one because they know what they're doing.
Okay.
And I think when it comes to the design and placing the screws with the Classic, because it's more open, you get more choice of your sites of where you want to put the screws. Because it's open, you can go anywhere. And as long as you're using a 1.2mm screw, the head's slightly bigger, then you can put it anywhere you like. But when you start opting for the fully protect cases, the examples, what they do, they will leave you a couple of options of holes where you may want to place the screws. But actually, they thought about it. They've not standardly put it into the framework. It's always going to be there. They've actually put it according to where your bone is. So actually, it's not something that's arbitrarily done. It's done based on the design of the bone underneath. So if you go for those holes, you're going to get enough. Tension on your screws. So no, I've never had to change a design. And when you are designing, you want to be looking where you want to put the screws in. So they know what they're doing, and they're great to phone up and ask advice as well.
Pros and cons of the system.
I mean, the biggest pros is that you don't have to worry about getting everything stable. It is done so easily, and I think that really comes across in the hands-on, because the hands-on isn't very long, because people are like, I put a screw in and like, that's it, like that's it. Okay. So it really does surprise people how easy it is to secure it and get everything stable. I mean, we're all implant dentists, we can all put a screw in. So they put a 1.2mm screw in and that's it. So that the hands-on is just really to prove to people that, this is stable quite quickly and quite efficiently. So again, I think that's one of the biggest things. Also, from a medical legal perspective, if you, touch wood, nothing ever happens to anyone, but if you have to show that you've planned this case, you would have had to take a CBCT scan. You would have had to design your graft. You would have had to have planned your implants. You would have done backward planning. So you've done your restoration. Where does the restoration go? Okay, where does my implant need to go? Okay, so now where's the graft need to go? So you can show all of this whole thought process. It's not something you've just gone and done off the cuff. You have actually given it some thought. So I think from a medical legal perspective, it really does cover you. And even if you're not doing it for that reason, because we shouldn't be, you're going through the stages. So you're going to miss less and less. You're going to have less and less surprises when you come to do surgery. Oh, that mental nerve was closer than I thought. No, because you've seen it and you've been designed around it. So I think less surprises and the stability are definitely key things that make a difference. Disadvantages, I think the biggest disadvantage is a delay. So you have to wait your 4 weeks for design and delivery, which I try and use as a positive, because I take the teeth out and let it heal. And then I'm forced to let it heal because I've got to wait for delivery. And it's also spun the other way because the patient knows it's customized to them. It's theirs. So yes, you have to wait a bit, but it makes it more personal for the patient as well. And the other negative is the closure. Although you're not overcompensating with your graft, knowing you're going to lose a bit of the volume, closure is key. And if you're not managing that, you're going to get some issues. And again, although an exposure with an Yxoss is not, it doesn't mean you're going to end up with nothing at the end of it. You'll end up with something, but it does compromise the graft in one way or another. So
Okay.
they're the disadvantages, I'd say.
That all makes sense. So, are there certain instances where you are just like, I'm really glad I've got this technology, or are there certain instances where it's just like, if I didn't have this, this would have been a real nightmare.
You know what? I set out wanting to do blocks, and I thought blocks and Corey is the way I'm going to go. And I just went on this pathway of like bit by bit, I was pushing the edge of my ability envelope, just testing the waters of new things and what did I like with the main goal of achieving blocks. And I got to the point that I found I didn't need it anymore. So I found that this technique is great for general practice because you don't need to be harvesting huge blocks to over augment certain sites. So it's something that's quick, relatively simple in comparison, and efficient. So, I mean, you can do a simple Yxoss in less than an hour, 45 minutes. It's not a major operation. And patients appreciate that. And the good thing is, because it's so adaptable, because you can design it to your own design and shape, you can use it for almost any case you want. So I felt that there was a system that I was saying, oh, can I use this? Is it going to be extended enough? I mean, when I was using bone rings, it's difficult to use on the larger cases because you've got to do so many. Maybe using a pinned membrane, can I get the stability? Larger grafts are much harder. How am I going to put all those lingual pins in? So you got to be very picky on what system you're going to choose. But I have actually found that you can use Yxoss for almost anything because the flexibility of the design is there. So you can use it for a single case just to get familiar with the system. And you're in safe hands. You're probably in a comfortable zone because it's something that you're used to using. And yes, it might be a little bit over the top to begin with, but it's going to help your learning curve. Patients going to get exactly what they want. They're going to get beautiful result. Once you've done a few of those, you can then start pushing the boundary again until you get confident with the larger cases. So I think being able to offer patients a treatment that they can physically see what they're paying for, and that can be adapted to pretty much any site in the mouth with that flexibility, it's just made my life so much easier.
Yeah, that's really interesting. So it's I love the perspective that you're coming at this. It's just made your life easier because I keep saying this. I'm very lazy as well.
Yeah.
I just want things to be simple and predictable.
I mean, once I found a technique, I could apply for almost any graft I wanted. The more you do it, the better you get.
Yeah.
And if you're using one technique to do all your graft materials, or 90% of your grafting cases, then you're going to get better at it.
Yeah.
But if you're using 10, 12 different techniques, you might get the hang of one or two. But this works for most things, and it makes you appreciate the four corners you're saying. You start with a simple case and you really start to appreciate these four corners, the stability, the blood supply, that all starts coming together because all of a sudden during the treatment, your mind is focused on other things, not the stability, the shape, all these other things occupy your mind. Yeah.
And in that context, it's going to reduce the stress of surgery as well, isn't it? So
makes it more enjoyable.
Yeah. You know what, Robert? I'm finding that sometimes people turn around and say to me, Pav, you're making implants way too complicated. You talk about this, you talk about that. It's like, look, it is a complex field, but once you understand it very deeply, the actual execution of it doesn't actually have to be complicated. I've been decarbonizing implants now for 9-10 years, something like that. Now other people are starting to do it now. I still think it's going to become more in the future, but a lot of the things that I talk about, managing oxidative stress, and even when I talk about histology and things like that, people are like, well, why are you on about histology? It's like, well, because if I understand the histology, I know that prepping D3 bone is very different to prepping D1 bone, and I understand how it all interplays with one another. But what all of this has done is, over a period of time, is I'm now in a position where, in certain cases, I'm placing the implant, doing the grafting, and placing the definitive crown at the same time for the patient, and the patients love it. And if I didn't understand this type of stuff, I wouldn't be able to do it. So are you finding that by going to the Yxoss that it's less stress for you? Are you having predictability? What are your main what are the main issues that you have with it as well?
I think once you get your first few cases under your belt, and like you say, you understand the fundamentals of what you're trying to achieve. Um, the fact that you can turn around to a customer and say, well, this is what you're paying for, and they provide a model, you can show them an example. You're explaining how the dentist has to understand the basic complexity in the case of how biology works. Well, the patient's the one that's making the decision to go ahead with treatment, and to helping them make that informed decision. If you can show them something and say, look, this is what we're doing, they will appreciate themselves a little bit more. Maybe they will look after it a little bit better because they understand it. Maybe the acceptance is going to be a little bit better because they understand what they're paying for and what they're going through. And maybe the acceptance of the bruising and swelling afterwards is there as well, because I've had this metal framework put in. So I think understanding. I mean, a great story is someone came in. My husband's not doing very much lately. You put an implant in him, yesterday. He's just lazing around. Pretty much what she said. So I invited her to the room, and with her husband, obviously, he didn't speak much English, and I just explained this is an X-ray of what your husband's had. Oh, I didn't realize he's had that. Okay, I understand why he's quite sore now. So I think the understanding of what you're going through at the dentist makes a difference. And just being able to get that across to people, to say, this is what you're having, this is what's involved, they get it a little bit better because they can handle it, they can see it, they can relate to it. So that's one of the biggest things I think I've had, because when you mention bone graft otherwise to people, they don't quite get it. And when you have a bit of xenograft in a bottle, they don't quite get how that's going to stick as well. So it's educating the client at the same time has made my life easier, because they understand what they're going to go through, and then everything else falls into place. So I suppose that's been one of the biggest changes. I can physically show people what to expect.
Amazing. So, I think one of the issues with doing this as a podcast is it's really something that you need to see, but most people are listening to this as opposed to watching it on YouTube. So I think to that extent, the best thing there, Rob, is if people wanted to see more about this, learn more about this, what's the best way to get in contact with you, please?
The best way to contact me is through my website. It's got all my contact details on there. So it's augmentationacademy.co.uk. It's got my email address on there. It's actually got my mobile number on there because people contact me that way and through WhatsApp. We do have a Augmentation Academy WhatsApp group as well. So a lot of people have signed up to that. And then I would try and keep people up to date with news and events that we're doing. And people do put cases. So it's great to see some of our previous customers that have been on courses present cases, what they've done. And they're quite keen to show off what they've managed to accomplish and things like that. So, and there have been quite a few topics that have come up, and people are coming from all over the country to give their opinion, which is great. You have great access to a high number of specialists, as well as myself. People don't always like to show a case on WhatsApp, so they will contact me directly and ask some advice. So yes, go to the website augmentationacademy.co.uk, and we have all our courses on there and all possible ways of contacting me.
Amazing. Rob, thank you so much.
No problem. Thanks for having me, Pav. Great to see you again.
So, folks, thank you very much for listening. I'm trying to do a mix of longer podcasts for you and shorter podcasts for you. So this one was slightly shorter because the last one was, I think it was over an hour. So it's nice to mix it up a little bit. So thank you very much for listening. And Rob, what's really interesting is the platform that I use to push the podcast out is there's a global map. And it tells you where people are listening from. Okay. And it's actually quite humbling that you get people from literally all over the place. You can see people in Philippines, in Japan, in China, in Canada, America, Dominican Republic, Mexico, and it's just I'm looking at it. I'm fascinated just watching this type of stuff. So it's really interesting.
brilliant. It's good to see there's such interest as well.
Yeah, I never thought that people would start listening to that much. I genuinely thought it'd be a handful of mates. That was it. So I very much appreciate everybody's support, and I appreciate even when I haven't been putting it on that as frequently, that people still come and listen when they do. Rob, thank you very much for your time. Thanks.
Anytime, Pap. Anytime. Take care.